Tell me something about flail chest. Sure, sir. Flail chest is a condition in which there is a fracture of three or more than three consecutive ribs at three or more places. It can result in pulmonary contusion where the flail segment can keep on hitting the lung parenchyma, and it can also result in a rare condition called as paradoxical breathing, in which the when the patient breathes in, the chest wall moves out and the flail segment moves in, and when the patient breathes out, the chest wall moves in and the flail segment moves out. And the treatment for flail chest includes analgesics and oxygen therapy. Initially, if no response is there, then intermittent positive pressure ventilation is given, and still if no response is present, then surgical correction of the flail chest is done. Okay. What is pneumothorax? Pneumothorax is an emergency condition in which there is air trapping between the visceral pleura and the parietal pleura due to an penetrating injury to the chest wall, and due to the injury, the side which gets injured, the lung gets collapsed because one valve mechanism is formed at that side, and on the opposite side, as a compensatory mechanism, hyperinflation of the lung is present, which results in increased respiratory heart rate, increased heart rate, and increased jugular venous pulsations, and hyper resonant note on percussion, and absent breath sounds on auscultation. And mostly the diagnosis is based upon clinical examination only, and the management of pneumothorax includes in emergency conditions needle thoracocentesis is done. In case of adults, a wide bore IV needle is placed in the fifth intercostal space at mid axillary line. In children, the needle is placed at the second intercostal space in mid clavicular line. And in cases of definitive management, tube thoracocentesis is done, in which intercostal tube is placed in the safety of triangle, and then the wound site is covered with gauze and taped on three sides. Okay, what is chloroquine? Chloroquine is an anti-malarial drug used for the treatment of malaria, in which the chloroquine binds with the hemoglobin present in the Plasmodium vivax species, and then it creates toxic heme compounds, and therefore causes a sidal effect on the parasite. And the parasite can develop resistance to this drug by producing a pump, efflux pump, through which the drug can be pushed out of the RBC. Thereby, the parasite can survive, and the chloroquine is used mainly in hepatic amoebiasis, also in malaria, rheumatoid arthritis, and in other autoimmune conditions like systemic lupus erythematosus. And side effects include convulsion, hemolysis, corneal deposits. And the dosage of chloroquine is on day 1 10 milligram per kg is given, on day 2 10 milligram per kg, and on day 3 5 milligram per kg. Okay, what do you understand by lucid interval? Sure, sir. Lucid interval is the time interval of normal consciousness period between two periods of unconsciousness. It is mostly seen in extradural hemorrhage, but not is a pathognomic sign of extradural hemorrhage, as it is also present in other brain injuries. What do you know about ankylosing spondylitis? Sure, sir. Ankylosing spondylitis is a type of polyarthritis type of inflammatory arthritis. It is mostly seen in the age group of 20 to 30 years, and most common joint involved is sacroiliac joint, and followed by pelvic bone. And the most common symptom which is present in ankylosing spondylitis is low back pain with reduced spine mobility, and in some cases it can also present with anterior uveitis, eye pain, and eye redness. Treatment mainly includes symptomatic relief. Since it is an inflammatory condition, we can give non-steroidal anti-inflammatory drugs for symptomatic relief, and we can also give disease-modifying anti-rheumatoid drugs such as sulfasalin. Okay, what are the anti-tubercular drugs? Name them, and what are the dosages? Sure, sir. Anti-tubercular drugs. The main first-line drugs of TB are isoniazid, rifampicin, pyrazimide, and ethambutol. Isoniazid, rifampicin, and pyrazidamide, all three are bactericidal drugs, and ethambutol is a bacteriostatic drug, and isoniazid is most commonly used drug of choice for prophylaxis of tuberculosis. It causes side effects of peripheral neuropathy, anemia, hallucinations, and therefore to prevent neuropathy, vitamin B6 is also given along with isoniazid. And in cases of the adverse effects caused by isoniazid, they are metabolic acidosis and seizures. For seizures, the drug of choice is pyridoxine, which is given in IV route 1 gram for 1 gram of isoniazid. Rifampicin is used for treatment of tuberculosis, leprosy, and non-tubercular mycobacterium, and it produces discoloration of the urine and secretions as reddish orange, also causes decreased platelet count. It also causes contraceptive failure if a woman who is on rifampicin and is also on a oral contraceptive pills, as it causes contraceptive failure because it is an enzyme inducer, and it also causes deranged INR. And side effects of rifampicin are polymyalgia, pseudojaundice, and uveitis. And pyrazinamide is mostly active against slow growing intracellular mycobacterium. It causes side effects such as hepatotoxicity, hyperuricemia, peripheral neuropathy, and arthralgia. And ethambutol is another first line bacteriostatic drug, and it causes optic neuritis and red green color blindness, and it is contraindicated in children. The second line drugs used for tuberculosis are para-aminosalicylic acid, moxifloxacin, levofloxacin, amikacin, streptomycin, bedaquiline. And the drugs, first line drugs with their dosages are isoniazid is given as 5 milligram per kg, 5 milligram per kg isoniazid. Then rifampicin is 10 milligram per kg, and pyrazinamide is 20 milligram per kg, and ethambutol is 15 milligram per kg. And for the treatment of TB, it is given in 2 phases: intensive phase and continuous phase. Intensive phase is of 2 months, in which isoniazid, rifampicin, pyrazinamide and ethambutol are given for 2 months. And in continuous phase, isoniazid, rifampicin and ethambutol are given for 4 months. And in drug resistant cases, in which only isoniazid resistance is present, we give a second line agent such as levofloxacin along with rifampicin, pyrazinamide and ethambutol for 6 months in the intensive phase. And in cases of isoniazid and rifampicin resistance, we give levofloxacin, linezolid, cyclosporin, and for 8 to 24 months as intensive phase, along with the bedaquiline of 400 milligram per day for 6 months in the intensive phase. Thank you.